Is it clear?
Yeah, much better, much better.
Thank you.
Much better. Let it be there.
कल ज्यादा है
Ma'am, should I start? No. Hello.
Brinda, I think we can start. No, time is already 9:52.
Yes, sir, we can start. Parul and Samiksha will be taking over, sir.
Yeah.
Rekha ma'am, we can start, right, ma'am?
Unmute your mic. Rekha, unmute your mic.
Yeah, please start.
Thank you, ma'am.
Thank you, ma'am. नमस्ते, मैं पारुल डाउन सिंड्रोम फेडरेशन ऑफ इंडिया के तत्वाधान में इंडिया इंटरनेशनल डाउन सिंड्रोम कॉन्फ्रेंस 2021 में मैं आप सभी का विनम्र स्वागत करती हूँ अपनी दोस्त समीक्षा के साथ।
Life is full of challenges, and every day one has to fight many battles to make ends meet. But for those who are connected with the cause of Down syndrome, every fight gets a little bigger and more challenging, many of which we have to win within ourselves. Good morning, everyone, and welcome to India International Down Syndrome Conference 2021. This event will offer you a deep insight into all the matters related to the diagnosis of the Down syndrome. That is why we can call it as the training ground for the new parents have been regularly attending these conferences. So let us be prepared to gather a lot of vital information on the first day of the conference.
वक्रतुंड महाकाय सूर्यकोटि समप्रभ निर्विघ्नं कुरु मे देवा सर्व कार्येषु सर्वदा। हमारी संस्कृति हमें सिखाती है कि जब भी हम कोई अच्छा कार्य शुरू करते हैं तो उससे पहले अपने इष्ट को याद करते हैं। तो आइए ईश वंदना करते हैं और उसके लिए आज हमारे साथ हमारे सेल्फ एडवोकेट हैं आदित्य सुब्रमण्यम जी। मैं प्रार्थना के लिए आदित्य सुब्रमण्यम जी को आमंत्रित करती हूँ।
गुड मॉर्निंग।
मॉर्निंग आदित्य।
गुड मॉर्निंग। वक्रतुंड महाकाय सूर्यकोटि समप्रभ निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा। अखण्डमण्डलाकारं व्याप्तं येन चराचरं तत्पदं दर्शितं येन तस्मै श्री गुरवे नमः। अज्ञानतिमिरान्धस्य ज्ञानाञ्जनशलाकया चक्षुरुन्मीलितं येन तस्मै श्री गुरवे नमः। गुरुर्ब्रह्मा गुरुर्विष्णु गुरुदेवो महेश्वर गुरु साक्षात् परब्रह्म तस्मै श्री गुरवे नमः। ओम पूर्णमद पूर्णमिदं पूर्णात् पूर्णमुदच्यते पूर्णस्य पूर्णमादाय पूर्णमेवावशिष्यते। ओम शांति शांति शांति। सर्वेषां स्वस्तिर्भवतु सर्वेषां शान्तिर्भवतु सर्वेषां पूर्णं भवतु सर्वेषां मङ्गलं भवतु। ॐ सर्वे भवन्तु सुखिनो सर्वे सन्तु निरामय सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत्। शान्ति शान्ति शान्तिः।
बहुत सुंदर प्रस्तुति आदित्य आपकी, और बहुत ही मन जो है भावुक और भव्य हो जाता है इस तरह की शुरुआत के साथ। तो अब हम एक हमारे दूसरे सेल्फ एडवोकेट को इनवाइट करना चाहेंगे, कोरक विश्वास जी को, जो हमारे सामने एक डांस की प्रस्तुति कर रहे हैं। दोस्तों, नृत्य जो है वो भी भगवान से जुड़ने का एक साधन ही है। तो मैं विश्वास जी को आमंत्रित करती हूँ। ठीक। बहुत बहुत सुंदर प्रस्तुति विश्वास जी। और जो इन्होंने सेट लगाया है उसके लिए मैं इनकी तारीफ करना चाहूंगी। हम सभी की तरफ से मैं बहुत धन्यवाद करना चाहूंगी कि उन्होंने इस कार्यक्रम को इतनी भव्यता प्रदान की है। और हम सब देख सकते हैं कि अगर ये प्रोग्राम लाइव में ना होकर सामने हमारे होता, हम मिलकर अगर इस प्रोग्राम को करते तो ये कितनी भव्यता के साथ होता। खैर, बहुत शुक्रिया हमारे एडवोकेट्स का जिन्होंने इतनी अच्छी शानदार शुरुआत हमें दी है। और अब इस कार्यक्रम की विधिवत शुरुआत हो चुकी है दोस्तों। तो हम पहले सत्र को शुरू करते हुए मैं इंडिया इंटरनेशनल डाउन सिंड्रोम कॉन्फ्रेंस 2021 के चेयर डॉक्टर सुरेश शास्त्री जी को इनवाइट करना चाहती हूँ कि वो आए और स्वागत भाषण के लिए हमें अनुग्रहित करें। I welcome Dr. Suresh for inaugural address. Dr. Suresh.
Good morning to all. Dr. Rekha Ramchandran, the spirit, inspiration and sheet anchor of the IIDSC, Mr. Ramchandran, Rahul Ramchandran, parents, self-advocates and dear children who are indeed the heroes and heroines of the day. This meeting is for you and to help to get the best of you and make each one of you a winner. At every IIDSC conference, opportunities are given to showcase your talent, and it's always a joy to watch each one of you take the center stage and show I can do it. And what a wonderful start we have had with Aditya reciting the invocation so lucidly and excellently, and Biswas's performance was absolutely outstanding. I don't think there can be a better beginning to a show, especially because we are virtual this time, but it almost feels like we are inside an auditorium. So that is the talent. My hats off to both of them and their parents for ensuring that their talents are truly shown out. DSFI, under the dynamic leadership of Dr. Sureka Ramchandran, has ably assisted by her team and fully supported by family, has provided the platform for identifying and showcasing talent amongst children who make each and every parent very proud. This is the 5th edition of the IIDSC conference, and last 2 years we've been unable to hold an in-person meeting due to the pandemic. And the in-person conference has always been very joyful and festive atmosphere. We can see children running around, each one of them trying to draw attention. Here's it, see me, this is what I can do for you. And I remember how we sit and without being able to move from the chair, watch each one of them, wait for the next one very expectantly. That has been the joy. But since this is an online meeting, we have to try to make the best of what is available and hope very soon we will have an in-person meeting. Maybe next year, I think we should have an in-person meeting. Today and tomorrow, we will try to gain knowledge from the experts who have always been ready to share their experience with us. We have a variety of experts from various specialties who have come forward and who will tell us how can we make life better. Understanding the problem, knowing the options available is always empowering, and every parent who has registered should make efforts to enrich themselves with a deep understanding of various medical, psychological, social aspects of Down syndrome. This will help each one to make champions out of their own wards. This will help. My earnest appeal to you is to constantly endeavor to identify each child's potential, nurture it, encourage them to achieve at their own pace. There is really no hurry. We are not competing with the rest of the world, but we are having our own world where we need to go forward at a pace which we feel joyful about doing each and everything. Every step move forward is a step of joy, and that brings smiles to our face. And that is what we are looking at. There are no timelines. It is just that we should ensure the children enjoy what they do, be it music, art, or just connecting with people. And soon you will see the transformation. And that transformation, believe me, is beyond all other achievements somebody can do. And that when you see it, when you feel it, that is beyond, that's an achievement that you can't compare with anything. On another note, from the medical world, research is going on at genetic level, and a gene controlling lipid function has been identified. But it's a long way from the bench to the bedside to see what we can do. But nevertheless, some progress is happening. In our own neighborhood, Dr. Priya Chandrasekhar, a pediatrician, and who has been closely associated, as all of you would have seen her with the DSFI, she has done significant area in the work of Down syndrome. She has recently published a paper on comparison of relationship of sleep disturbances and its outcomes in normal and Down syndrome children, which gives an understanding of sleep fragmentation in Down syndrome children, and going to be very, very useful for treating sleep apnea in kids there. This is a very significant achievement, and I congratulate Priya on getting this done. And it has come very timely, just before the start of the IIDSC conference. So I encourage you all to have a copy of the paper and read it. And I'm sure she'll tell you more about it. Now, DSFI, as you know, has always encouraged research in Down syndrome, and awards have been given for pioneering work in this field. And this is truly an encouragement. This year's conference, although virtual, has a galaxy of experts and plenty of opportunity for interactions. So you should not miss as parents interact and get all your doubts cleared, because it is the clarity of the mind that actually ultimately tells you what you're doing is right. and are you on the right path? So to put yourself on the right path, you have to make the effort to learn. And when there's somebody willingly gives their knowledge, you just grab it. And this is one platform which brings everybody together. And that is the celebration. It's indeed a celebration. And year on year, and every year we see something new, some different methods of approach, which makes us feel good and also makes us feel that we can become better in this area. So this is the unique platform of various specialists for addressing only one condition called Down syndrome. And I do hope that all of you will enjoy the sessions today and tomorrow. Wishing you all the very best, and my love to all the dear little heroes and heroines of the day. It is because of you we are all here today. Thank you very much for this opportunity.
Thank you so much, Dr. Suresh, for giving that clarion call to our first day of the conference. And now we straight away move to the first speaker of the day, and she is a leading pediatrician, specialist of Chennai, Dr. Priya Kumar, to please address the audience. Yeah, welcome, ma'am. Over to you.
Very good morning to all of you. In India, we believe in starting everything with a song and dance. So rightly so, with an invocation and followed by that lovely performance. So thank you, DSFI, Dr. Rekha, the family, Dr. Suresh, and all of you for this opportunity. Life is generally a journey of learning, relearning, unlearning. So to start off, so I'm just going to share some snippets on the pediatric issues that one faces. Just 1 second. Yeah, is my screen visible?
Yes, ma'am.
Yeah, okay. Thank you. So there is actually quite a bit to, talk about, but I'm going to try and just compress whatever in a short period. So we'll talk about some of the health issues that, what we should look for, what are, roadblocks and how to handle them. So we will look at, the overall growth and development of children with Downs. This is only a condition, and, most of the path is along the same road as other children. There are some deviations which we need to address and correct. We will also look at nutrition, specific issues, what are the problems we look at in various organ systems, infections, monitoring, puberty, and the passport. So we know growth is a dynamic process and increase in the physical size of the body as a whole. So every visit to the doctor is always, in terms of height, weight, head circumference, etc. So these are very sensitive indicators and helps us to know if our child is growing in the right direction. Any issues are there in the early stages to find out if there is right nutrition, whether it's under or over, and to thereby address problems, in relation to that. So we measure the height using a stadiometer, weight using, infantometers or scales, and head circumference. So in the first 12 months, when the baby is born, there is usually a doubling of the birth weight by about 5 or 6 months. Then they triple by about a year. There is increase in length by nearly 50%. So the first 4 months of life is when there is maximum growth. 5 to 8 months is the time of transition following that. So what is different in children with Downs? So initially, there may be a slight decrease in growth, which can be detected antenatally itself. That is when the baby is in the womb. Growth pattern will differ significantly, usually from the 6th month onwards. So we have tried to do a study in about 200 children, more from the south of India, and to see if the growth curve is following the same curve as what is already available by the Indian Academy of Pediatrics. So when we look at curves, usually each child has to grow along its curve. So you see the straight lines, the on top, which is red, green, dark green and brown. The dotted lines below are in the growth curves of children with Downs. This varies both in boys and girls. I just superimposed it so for you to have an idea. So the lower curve is the 10th centile. The one in the middle is called the 50th centile. That is 50% of children will grow around it. And the top curve is the 75th centile. So it is different again for girls. So when we did the comparison, we got a p-value of between 0.001, which means the 10th and the 50th were quite significantly different. So it is important for us to have our own growth charts so that we know if our children are growing well. This is for height in boys and girls. Similarly, this is the head circumference for boys and girls. Yeah. So a baby itself is a miracle, especially a child with Downs, an absolute joy. So we spoke about the physical growth. What is cognitive development? There are four main things which happens. After physical growth, there is cognitive development or the development of the brain in terms of first physical structure and developing the various functions. Then followed by immune maturation and the digestive maturation. So though the brain occupies only 1 to 2% of the entire body weight, it needs 20% of energy that is totally consumed. So it is important that the digestive system is having proper maturity and we address any early issues which may be stumbling blocks in these. Similarly, immune maturation takes about 2 years to be, fully competent. So meanwhile, we need to see what we need to do to improve immunization, improve nutrition, and tackle infections as we go along. So nutrients, there are three main things which all combine together to help in the developing stage. First, we have the genetic factors, but this is only a portion of it. Nutrients and supplying adequate nutrition, having a good maternal and infant bonding, and having a good environmental stimulation play key roles in overall development. What about the problems in feeding? These vary according to the age of the particular child, infant, child, or older child. So in early infancy, because of the anatomical difference in children with Downs, there may be difficulty in sucking or swallowing. In mid-infancy, infancy means between birth to 1 year of age. In mid-infancy, there can be a lot of reflux, which means whatever is taken, especially liquids, milk, or even other juices or whatever is given, may keep coming up. And there can also be a lot of passage of stools like malabsorption. In late infancy, it can be neophobia or fear of new food, constipation, and cow milk protein allergy. So the factors that can affect the feeding are the quantity, quality, and texture of the food, whether the child has a good appetite, is in the right frame of mind, is able to taste it, or is ill, and how the feeder, the caregiver, is empathetic and takes part in this activity. So we know that even if children are having only smaller quantities of staple food like cereals and pulses, you can enrich the food using oil, ghee, jaggery, or sugar like brown sugar. And it's important to give a good diet of animal foods for those who are consume them, adequate vegetables and fruits, vitamin C rich, and it's important to supplement with calcium, iron, zinc, and vitamin A, B, and D. Now, calcium and vitamin D are quite low in many of our children, so it's important to look for them, especially when we keep checking the thyroid. It can also use thick and malted feeds, which are those which are calorie dense. A few key points on certain nutrients. One is DHA. This is one of the main constituents of the cell membrane in both the brain and in the retina, and helps in improving learning, memory, and the neuronal function. Another important substance is carnosine, which is a histidine, like it's an amino acid. It is
Hello, ma'am.
synthesized in the body.
Sorry to disturb. Ma'am,
So,
आपकी hello.
If there is a decrease in the amount of carnosine, it is important to supplement. So we have tried the supplementation and found that it has actually enhanced the cognitive process, overall functioning of the nervous system, and the language skills. So this acts by being an antioxidant and by scavenging the reactive oxygen radicals, and is neuroprotective and helps in ion chelation. As we spoke earlier, vitamin D is also one of the key nutrients. It's like the magic vitamin. It not only plays a major role in growth and development, but it improves the immune function. So in children who are going on falling sick, make sure you talk to your pediatrician and find out if there is a decrease in the vitamin D level. It will improve the CAMP, which will improve the immune function. So all these together help in overall expressive and language speech development, socialization, fine motor development. Another important thing that we see in our children, which is present up to the range of even 30%, is cow milk protein allergy. CMPI means cow milk protein intolerance, or CMPA means cow milk protein allergy. This can be mediated by an immunoglobulin called IgE, which may be present in some children, or it can be a non-IgE mediated. So what happens is the milk protein present, the cow's milk protein acts as an antigen, like acts as a foreign body. So because of this, there are adverse reactions, increased amount of respiratory infections, etc. So in children who have this, it is better to avoid milk and give it in a fermented form, like curds, paneer, etc. So all these problems usually occur because there is an inherited deficiency at the cellular level, at the hormonal level, at the enzyme level, and at the thereby affecting immune function. So when there is in children with trisomy, what happens is there is oxidative stress which happens early, like superoxide dismutase. I will tell you some of them as we go along. So this causes an increased cellular stress response. So it is important to supplement with those who are those substances which have antioxidant. Thereby they act as a compensatory mechanism and improves the overall functioning of the child and the lifespan. If there is sustained DNA damage and we don't address the stress, then there is accumulation of oxidative damage, which leads on to these problems that we see, diabetes, other related complications. So the oxidative stress is caused by this copper or zinc superoxide dismutase and some of these amyloid precursor proteins, etc. So whatever antioxidants we give tries to act against this. So these affect the various organs. We look at each one as we go along. So most children, nearly 45 to 50%, have some kind of a cardiac issue. It can usually be in the form of a congenital cardiac disease where atrioventricular septal defect is common. So when the baby is born itself, it is important to get a proper history, do a good physical examination, get an echo done by a pediatric cardiologist. And the medications, like the interventions, can be in the form of medication or surgery depending on the type of problem. 15% of children do tend to have some amount of tone abnormalities or seizures. So in these children, it's important to get EEGs, scans if needed, if necessitated by the person who is assessing your child, and give suitable anti-epileptics or related medication. The commonest problems we see are more in relation to respiratory system. So nearly 35 to 40% children can have either upper respiratory tract infection or lower respiratory tract. Pneumonias are quite common. Similarly, sleep apneas and bronchiolitis. So these can be treated these infections usually occur because of the abnormal anatomy of the respiratory tract and the hypoplasia, that is decreased formation of the nose and sinuses, and the mid-phase hypoplasia or a change in the formation of the nasal area and sinuses. The acute lung injury and problems can be because of decreased amount of Polis cells or granulocytes or leukocytes as we call them. So a good history, physical examination, an X-ray if needed, or more increased investigations like a CT, etc. may be needed. So the commonest treatments would be in the form of antihistamines, which will control the allergies, bronchodilators, and antibiotics. Hospitalization or nebulization may be required as and when the need arises. So these are the problems which arise because leading on to infection. There is first a poor decrease in the immune factors. So there is a suboptimal antibody response in the body itself, and there is poor chemotaxis. So the cells which have to be removed are not removed adequately. Reflux, ear anomalies, and airway anomalies contribute. So these lead on to multiple infections. So we need to probably do a good examination, immunoglobulin profile, and protect them by giving proper vaccination and medication. The ear problems, again, a ear examination is very common and should be done periodically because recurrent respiratory infections can lead to decreased hearing. So there can be a sensory neural loss or other kinds of problems with fluid in the middle ear, etc., which can be addressed earlier before it leads on to decreased hearing. So an ENT specialist should examine, and audiometry, an OAE or a BARA should be done, and suitable medication, surgery if needed, or prophylaxis can be given. A lot of children also have some hypotonia and joint instability because of the hypotonia, and either a cervical, that is in the neck region, there can be an atlantoaxial dislocation or hip problems. So these should be addressed and seen by a pediatric orthopedic surgeon, and an X-ray will help us to identify what the problem is. Suitable physiotherapy, calcium and other mineral supplements can help the child recover. So visual problems are present in nearly 20%, and these are usually in the form of refractive errors. Some children can have cataracts or squinting and glaucoma. So a good eye examination with the pressure checking, pressure of the eye, intraocular pressure it's called. All these can help in be managed with glasses and medication. Again, just like infection and respiratory infections, gastrointestinal infections or gastrointestinal problems like vomiting, reflux, constipation, etc. can also be occurring frequently. So a good examination, an ultrasound if necessary, a stool test, and specific tests for celiac disease if suspected, with management using milk or gluten-free diet, anti-reflux medications, laxatives, probiotics, etc. could help. There can be dental problems in the form of gum disease or cavities. It's very important to address this because the mouth and the oral cavity has the main source of bacteria which lead on to these infections. So regular dental checkup by a pediatric orthodontist, using a good fluoridated paste, filling cavities and root canal treatment are of utmost importance. Nearly 50% of children have hypothyroidism or hyperthyroidism, and they may be prone for diabetes. So regular in the first year, probably every 3 months, a T3, T4 and a serum TSH, or only a TSH itself after the initial evaluation, and periodic evaluation 6 monthly following that. Adequate medication and follow-up are required. So hematological problems can be in the form of anemia or very rarely malignancy. So appropriate diagnosis and treatment are recommended for this. So one thing that one must remember is the presence of any psychiatric issues like depression. This lockdown has made all of us feel actually a bit depressed, more so in children with Down. So it is important to identify them early and treat accordingly. So this would make a dramatic impact and in the overall behavior and management. So things like exercise, music, dance, yoga, all these are mood elevators and keep both the body and the mind fit. Another important thing are genitourinary problems like urinary infection. These should be identified early and treated adequately. We spoke about sleep mechanisms. When we sleep, the oxygen is taken in and carbon dioxide is released out. Because of the altered anatomy, there are more problems of altered sleep like decreased growth, snoring, insomnia, or obstructive sleep apnea. So this is caused because of the soft tissue collapse in the pharynx and the difference in the pressure, which does not keep the glottis present in between open. So the airway gets obstructed. So as I said, the anatomical factors that contribute are the increased size of the tongue, the smaller area present, the abnormal positioning of the maxilla and mandible, the length of the soft palate. So all these can be assessed by an ENT surgeon. In addition, there can be hormonal imbalances of all these hormones, which follow what is called a diurnal pattern. So if sleep gets disturbed, all these can get disturbed. So the identification is by either increased sweating, unusual sleep positions, snoring, behavioral problems, and learning disabilities. So these can be managed using after assessing by a good ENT person and appropriate treatment. Obstructive sleep apnea, nasal CPAP therapy is not the be all and end all. So that is only for very severe cases. So other small things like managing allergies, positions, managing the airway abnormalities or the ear anomalies, managing reflux, all these can help in improving the sleep and the infections that occur because of all this alteration. So we know that viruses, bacteria, parasites, and fungi are the main substances or organisms which cause infection. They invade the cell, and because there is an altered immune system, there is easy presence of infection. So T cells and B cells are the main WBCs or the police in the body. So there is mild to moderately reduced T cells or B cells. The thymus size is also smaller, and there can be decreased total and specific IgA in the mucosa, which may prevent, not protect against infection. This is the immunization schedule. So things to remember other than the usual vaccines are, it's very important to give the pneumococcal vaccine and the influenza vaccine. Hib and rotavirus is against diarrheas. Pneumococcal is against pneumonias, and influenza is given yearly to protect against recurrent infections because of the flu. So regular monitoring should be a complete blood count, TSH, T3, T4, calcium, vitamin D, eye ENT examination periodically, physiotherapy, speech therapy, various therapies we will see in detail tomorrow. And it's also important to maintain a good passport, so everything is in sequential order. Early intervention is the mainstay of therapy, so it can make a difference in realizing their potential abilities and improving the quality of life. I know I went a bit fast, but I'm trying to, see if I can, give you all the nuggets within a short duration. So thank you for your patient listening. I'll be glad to take any questions.
Thank you, Dr. Priya, for this wonderful presentation. I think all the aspects of health are covered in this presentation. And हमारे दोस्त जो इतनी patiently सुन रहे हैं और देख रहे हैं, मैं आप सबका भी धन्यवाद देती हूँ इतने अच्छे आपके पार्टिसिपेशन के लिए. और डॉक्टर प्रिया से आपकी जो भी सवाल हैं, एक दो सवाल चैट बॉक्स में भी आए हैं, जो भी सवाल है अगर आप डायरेक्ट पूछना चाहते हैं अगले 10 मिनट में आप पूछ सकते हैं. अपना हैंड आप रेज करेंगे तो वृंदा जी आपको अनम्यूट कर देंगे और आप अपना सवाल पूछ सकते हैं. इस प्रेजेंटेशन में डॉक्टर प्रिया ने जितने भी हेल्थ इश्यूज हो सकते हैं उन्हें बचपन में ही, बहुत छोटी उम्र में ही एड्रेस करने की सलाह दी है, क्योंकि जब छोटी उम्र में हम उन सब हेल्थ इश्यूज को एड्रेस कर लेंगे तो बच्चे के माइलस्टोन्स को अचीव करने में हमें बहुत सहायता मिलेगी. क्योंकि इन सब चीजों की वजह से, जैसे थायराइड का इश्यूज है, स्लीप का इशू है, या फिर आंखों का या कान का है, या किसी भी ब्लड का किसी भी चीज का इशू है, एनीमिया है या बच्चे को, या कोई और प्रॉब्लम है, तो उसके माइलस्टोन्स को अचीव करने में हम उतना ही लेट होते चले जाएंगे. तो इस बात का हमें ध्यान रखना है कि हेल्थ की इन छोटी छोटी चीजों को हम ध्यान में रखकर चलें. डॉक्टर प्रिया, एक सवाल जो है वो चैट बॉक्स में आया हुआ है आपके लिए, फूड से रिलेटेड है. रोहन अरोरा आस्किंग टू प्लीज मेंशन फूड्स which we can include in our diet enriched in vitamin D.
Okay, vitamin D is called the sunshine vitamin. So
Yes.
we don't have to go looking for it. It's right outside our door. So it's important to expose our children and ourselves between 10 a.m. to 3 p.m. This is when there is maximal vitamin D absorption. Usually for at least 15 minutes, 25% of the body area has to be exposed. So make your children wear shorts or, sleeveless t-shirts, etc. And, walk around for about 15 minutes. So it's abundant and it really helps us.
थैंक यू डॉक्टर. रोशनी पूछती हैं कि क्या कोई सप्लीमेंट्स हैं जिसका बहुत जल्दी क्वेश्चंस आ रहे हैं अभी चैट बॉक्स में.
Shall I just look at them and answer?
Yes, please, doctor.
So it says the issues of heart and thyroid are mostly detected at birth or in the early years itself. So heart problems are detected early. But the thing to remember is, even if you have done a surgery, it is important to do periodic checkups because there can be alteration in the pulmonary pressure levels even at a later date. So it is important to have a continuous follow-up. And somebody else has asked, do we have to wear sunblock when we are sunbathing for vitamin D? Definitely not. The whole idea is to get enough of vitamin D. So if you wear sunblock, then obviously everything gets, it's not going to get absorbed enough. Somebody else has asked, previously you have suggested about usage of Cognicare syrup. Please let us know if it can be used for a 11-year-old child. So this is a brand name. So the basic substance that is there is carnosine, L-carnosine. So we have found in a very large study and, over a period of time, we have assessed the motor functions, the mental functions, the verbal functions, the gross motor and fine motor. And we found that there was a dramatic improvement in these children. So there is no timeline which you need to use it. So it can be used from infants to any number of years. It is also used in other conditions like ADHD, even in those children with seizures, etc. It basically improves the cognitive function. So it can be used in 11-year-old or any other age group. Somebody else has asked, I'm not able to see the chat fully. It says somebody can't sleep at night and she kicks her leg. So there can be any leg pain, even vitamin D or calcium deficiency can manifest in the form of pain in the night. So that itself can cause a lot of restless sleep and kicking around. So it's important not only to look at the nose and ENT, but also to look at the child as a whole. And if there is any deficiency, probably some small blood test itself will show us and it will be easy to address it. Another person has said, my daughter's 10 years old, but she can't sleep in the right position. So again, the same thing as I said, you'll need to find out why she's not able to sleep. It could be even a reflux. So according to it can be an obstructive sleep apnea. So you need to find out what is the cause and treat it accordingly. Then somebody has asked, what is the dosage for L-carnosine? See, there is no, usually in children, everything is according to weight. So it's important you talk to your pediatrician and then supplement, because these are not like food or something which you can just take like that. So it's important to find out for your child what is the dosage required. And we may need to increase it or decrease it based on the response level.
Roshni also asked, do you recommend routine supplementation with Carnishore and DHA to all our children?
Yes, I do recommend. DHA is something that can be taken from at any age by anyone, any of us also. So it is, it improves, it manages the oxygen radicals as we saw. Because there is ongoing free oxide radical damage, it is important to continue the supplementation of both. Somebody has asked, I'm not able to see it, it went away. One second.
Sushma is asking, my daughter is 9 years old. She is sleeping only night 10:30 to morning 7:30 a.m. Daytime not getting sleep. She is getting bad betting daily, night, and constipation problem 4 to 5 days.
Okay, so constipation is one problem which you need to, the treatment is not 1 day or 2 days, it's over some months. So where you need to make sure that the stool is softened, the diet is okay, which helps in keeping the stool soft, and to train the child to sit and go, not stand and go. And the sleeping again may be related to various other reasons that we spoke about earlier.
Radha is asking, my son is 12-year-old and now only I am giving brain DHA syrup. Is it okay to give it now? If is okay, how long I can give?
So as I said, see, these are different brands. So you just need to see if you're getting about 100 milligrams of it, and it can be given for any number of days. There are no side effects and there are no adverse effects because of prolonged administration.
My daughter is 13-year, 52 kg. Please suggest medicine name for calcium and vitamin D.
So the calcium and vitamin D, there are many brands, there are thousands of brands available. So there are things which are called a routine supplementation dose and a deficiency dose. So it's important to find out if the child needs only regular supplementation or if the child is deficient. So the dosage will vary depending on the what is the state of the child.
हमारे पास बहुत सारे सवाल हैं डॉक्टर प्रिया, और हमारे दोस्तों ने भी हैंड रेज किया हुआ है, लेकिन मैं माफी चाहती हूँ क्योंकि समय की कमी है और हमें आगे बढ़ना होगा। लेकिन आप अपने सवाल हमें भेज दीजिए और हम डॉक्टर प्रिया से उन्हें कंसल्ट करके आपको वापस जरूर कांटेक्ट करेंगे। शुक्रिया बहुत बहुत आप सभी का, और डॉक्टर प्रिया एक बार फिर से आपका शुक्रिया इन सारे सवालों का जवाब देने के लिए और इस बहुत प्यारी सी प्रेजेंटेशन के लिए। आप हमेशा की तरह बहुत सुंदर लग रही हैं।
Thank you, Priya.
Thank you so much.
For being there for us. Thank you so much for answering so many questions. Yes. We will send you the rest of the questions. You can answer them at your leisure. Thank you so much.
Thank you.
अब मैं डॉक्टर जयश्री गोपाल को आमंत्रित करना चाहूंगी, जो कि एक एंडोक्राइनोलॉजिस्ट हैं और डाउन सिंड्रोम से प्रभावित व्यक्तियों में पाई जाने वाली थायराइड व इसके जैसी समस्याओं से हम सभी दो चार होते हैं। तो आइए स्वागत करते हैं डॉक्टर जयश्री गोपाल का और जानते हैं उनसे एंडोक्राइनोलॉजी के बारे में।
Good morning. Thank you very much.
Good morning, doctor.
You can see my screen, no?
Yes.
I've started sharing. Thank you. Thank you. So I think Dr. Priya in her talk had referred to the endocrine system briefly, the thyroid at least aspect of it. I'm going to talk a little bit about the thyroid. Some of you may have heard me before. And also a couple of other endocrine issues which may be relevant and which sometimes I'm asked questions about. For those of you who may not be aware of the endocrine system, these are all little glands, tiny little glands. They're only about like 1 centimeter at the most of them, except for the thyroid, which is fairly big. And they're scattered all over our body. And basically, they work as a communication system. So to communicate our various aspects about our environment. You know, are we feeling hungry? Are we thirsty? Is it hot? Is it cold? What do we need to do? So it's sort of a communication system that relays information from outside to our body and to various parts of our body also. And the reason why it is so important, particularly because it plays a very important role for during growth and development and for attainment of puberty. It also controls, among other things, the stress response, controls our blood sugar levels, many other things. But these are some of the things I thought I should mention. And after the age of sort of growth and development, all through our life, it helps to maintain normal homeostasis. So for example, if your blood pressure goes up or it goes down, or your sugar goes up or goes down, or your sodium levels goes up or down, our endocrine system is the one that is waiting to bring it back into the normal range. So that is a very important function of our endocrine system, maintaining what we call the normal balance in our body, or homeostasis. And with specific reference to the thyroid gland, because like Priya had mentioned earlier, thyroid problems are very common among children with Down syndrome. So the thyroid is a gland present here. It's about 4 centimeters in length. It's a we call it a butterfly shaped gland, and you can see the shape here. That's why we call it that. All of us have a thyroid gland, and normally it makes enough thyroid hormone, which works on every single cell in our body and has an effect on metabolism. And in turn, this thyroid gland is controlled by something from the pituitary. Pituitary is a little gland present in the brain, and that makes a hormone called TSH, thyroid stimulating hormone. I'll come to the TSH in a minute, but these are all the functions of the thyroid. It has, for example, it has a role to play in controlling the heart rate, how well the heart beats. It has a very important role to play in digestion. So very commonly when we see thyroid problems, either people are having constipation or they're having frequent bowel movements. Very important in children because it plays an important role in brain development. That is why for all newborn children, currently it is recommended that we check the thyroid. Some parts of the country do it for all newborn children, and it should be taken up. There are a lot of countries around the world check thyroid for all newborn babies, not just because your mother has a thyroid or because you have some problem or genetic issue identified, but all children need to have their thyroid checked at least about 4 to 7 days after birth. It plays an important role in our bones, muscles, many things. Every head to foot, every single cell needs thyroid. That is just the best way to remember the thyroid. And why it is so important, particularly in Down syndrome, to check for the thyroid is because if there is thyroid abnormality, either if the thyroid is working less or more, it affects normal growth and development. So that is the reason why it's important to check the thyroid periodically. And more important, if we pick up a thyroid problem and we correct the levels by giving the tablets, then this growth and development will come back to normal. So that is why it's important to periodically check for the thyroid function. And this is just a graph to show, this is, some of you may have seen this. This is a graph of what we call the height versus the age. So you can see age is here, height in centimeters is here. And this is a child who, because of a thyroid problem, you can see from the up to the age of 3 years, this child was growing well. After the age of 3 years, the height fell off. So you can see that this has to be the normal height. It's not happening there. It has fallen off the growth curves. After the thyroid problem was identified, in this case a bit late at the age of 9 or 10 years, and thyroid therapy was started, the growth caught up again. So this is among the many things that happens because of thyroid, but it drives home the point that regular periodic blood tests could have potentially picked up the thyroid earlier and allowed this child to grow along a better growth curve. So that is why we keep on saying, keep checking the thyroid once in 6 months. And you would have seen a lot of this. Is my thyroid hypo or hyper? Very simply, hypo means the thyroid gland is not making enough. Hyper means it's making too much. And we look at the blood tests and we know whether the gland is working less or more. Predominantly, the commonest problem we see is hypo. though we do have a number of children with Downs who are actually having hyper, and we have to treat them also to get the thyroid levels down. But I would say about 90-95% of the children, when we pick up a thyroid issue, it is hypo or an underactive thyroid gland. And you would have seen this value called TSH. That is a single test we keep saying, and it stands for something called thyroid stimulating hormone. It is made by the pituitary gland. The reason I'm going to spend a couple of minutes talking about this is because sometimes there is a lot of confusion as to you're saying my thyroid gland is underactive, but this TSH value is high. Why should that be? And this is because the thyroid is something, the TSH is something that's made by the pituitary gland. When the gland is not working enough, the pituitary gland senses it and it puts out more thyroid stimulating hormone so that the thyroid gland can work more. So that is why the TSH levels will go up. If the TSH levels are higher than normal, then to us it indicates that the thyroid gland is not working enough. In other words, it's underactive or hypothyroid. And of course, the reverse happens in hyper. When the gland is working too much, it again sends a signal to the pituitary. The pituitary says, okay, I don't need to make this much of thyroid stimulating hormone. I'll shut it off. So the TSH value comes down. So it is low. So sometimes I see that people get confused because they say, you're saying it's underactive, but TSH is high. It is high because it is the normal feedback in our body. And this is how we interpret the values and come to a diagnosis. We do use T4 and T3 levels also, but quite often what happens is that the T4, T3 may be normal. It may be within the normal range. If you look at the thyroid values, you can see that the T3, T4 values have a very wide normal range. T4, for example, can be anywhere from 4 microgram per DL to say 12 microgram per DL. And you can be at anywhere on this range, but the TSH value may be elevated because for you, that level of T4 is not proper. So for you, a T4 level of 5 or 6 may be within the normal range, but for you, that is low. So your body senses that and makes the TSH go up. So that is why when we say check for the thyroid, we say check a TSH because that's a very sensitive indicator. The body knows exactly how well the gland is working and the TSH levels start going up as soon as the gland becomes working less. Now, these are some of the very common symptoms that we see in hypo. I'm not going to talk much about hyper right now, but these are the common symptoms. And this is what we tell parents to watch out for in their children. A child that was very active becomes more dull and lethargic and is trying to curl up in corners and not being as active as normal. Weight gain can be seen, dry coarse skin, dry brittle hair, change in the mood. Children tend to become more depressed. Puffiness of the face because of water retention, constipation. These are all the common symptoms of hypo or an underactive thyroid. In other words, your metabolism is slowing down. And these are some of the typical symptoms that we would see with an underactive thyroid gland. And it is very common, so common that by the age of about 10 years, about 30% of children may have developed hypothyroidism. So 1 in 3 children may have developed a hypothyroidism. At birth, about 7% of children may have hypothyroidism. So it is important that we check for thyroid, like I said, for all children at birth, and thereafter periodically every 3 months or 6 months during the growing years to make sure that the thyroid gland is remaining normal. So this is a commonly asked question. How frequently should my child be tested for thyroid problems? At birth and every 6 months thereafter is what I recommend till the age of 4 years. And what we need to check is TSH, free T4, and something called thyroid antibodies. I'll talk about what these antibodies are in a minute. And after the age of 4 years, maybe we don't need to do it that frequently. We can do it again every 6 months to 1 year if the thyroid has been remained very normal, because the first 4 years, the thyroid is very important. It still remains very important after that. But the frequency of checking is sometimes reduced to once in 1 year. But if you feel that your child is not growing fast enough or has developed some new complaints, being more constipated, more skin dryness, more hair fall, remember to check, think of the thyroid and check for it. So any sort of these symptoms which is suggesting a thyroid underactivity. Now, what are these thyroid antibodies? Again, I see a lot of reports where thyroid antibodies are checked, and there is a lot of confusion about it. What these are antibodies which our body makes. They're little proteins or chemicals which our body makes against the thyroid gland. And high levels of antibodies only mean that the gland, it is preventing the gland from working at its full potential. So the presence of these antibodies is for us an indicator that thyroid problems are likely to be present, or if it is not present at the current time, it may develop in the future. So that is really the only significance of antibodies, because sometimes what happens is antibodies are done for a number of reasons. Antibody levels are high and people get worried about it. If your thyroid gland is working normally, so your TSH level is normal, your T3, T4 level is normal, do not worry about high levels of antibodies. By itself, those antibodies do not cause any other problem apart from this thyroid not working properly. So if your thyroid is working properly, no need to worry. This is an again very common concern that we see in Down syndrome. What if my doctor says that the thyroid levels are normal, but my child has symptoms that suggest a thyroid problem? This is very, very common because the symptoms of an underactive thyroid, hypothyroidism, all the things that I mentioned, particularly constipation, skin dryness, dry brittle hair, a growth which is slower than normal, growth restriction, difficulty walking, are all very common anyhow in children because of the underlying genetic issue. The thyroid may be a contributing factor or the only factor in some of the children, but that is very rare. If you take about 100 children with these symptoms, the thyroid may be causing the problem or contributing to the problem maybe 10 to 15% of the time. The remaining 85 children will have a normally working thyroid. How do I know that? Because the blood test is saying so. So it is common because the symptoms of a thyroid dysfunction are very what we call non-specific. It does not mean that there is definitely a thyroid problem. So the decision to treat thyroid or not to treat is dependent completely upon the blood test and trends in blood test. And what if my thyroid levels are borderline? So quite often we will see TSH values which are like, say, just above the upper limit of normal, but a pediatrician would have said, no, it is normal for the age, we can watch it. Why that happens is because the TSH values change with age. So I'll just go to the next slide and come back to this for a minute. So the TSH values are highest at birth. They slowly decline with age. And then after the age of 60 or 70 years, they start increasing again. So this is the change in the TSH that normally occurs all through our lifespan. So at birth, it's very common to see TSH values. Remember, I said that TSH is the most important test we use to determine if the thyroid is working normally or not. At birth, TSH values will be very high. Up to the age of about 10 years, you can still have values of 6 or 7 and still be considered within the normal range. By the time you are 12 or 13 years old, about the age of 10 years, your TSH value should be around 4 or 5. It should not be higher than that usually. And thereafter, it should remain at that level till about the age of 60 years. After the age of 60 or 70, it again starts going up again. So interpreting the TSH value and trying to decide if a borderline value of the TSH is truly indicating some thyroid problem, it is the work of the doctor. It is the work of the physician, the work of the endocrinologist. So we have to decide based on the symptoms, based upon what is the trend in the TSH. So let's say one TSH value was 2, the next time it's 3, next time 4, 5, 6, every time it's going up, then I know that yes, the gland is becoming underactive. So rather than looking at one single borderline value, I try to look at trends, I look at other symptoms, look at the child as a whole before we decide if the thyroid needs to be treated or not. So it is not uncommon to see borderline thyroid values, but if your doctor says that, no, this is indicating a normal thyroid function, and the child is otherwise well and growing well and has no symptoms, running about active, then don't worry about TSH values, which according to the lab is not looking okay. So remember, up to the age of 10 years, levels of the TSH, which is slightly above what is called the normal range, but up to 8 to 10 may be considered normal. So like I said, we do not worry too much about these values at a younger age if it looks above the normal range, provided the child is otherwise normal. If you have any doubts, please reach out to me. Quite often we look at the reports and we decide if the thyroid levels need to be treated or not. So when there is a child who is referred for a borderline TSH and your doctor has said, no, this is normal, don't worry about it. What are the things that I do? I assess, like I said, the child, I look at, is there any evidence of any swelling in the neck or goiter? What are the thyroid antibodies saying? How is the TSH value changing over time? For us, that is a very important indicator. And this is not an emergency. So I may say, repeat the TSH after 3 months or 6 months, because thyroid is something that is slowly developing over time. So we may wait for 2-3 months, look at a TSH again. Sometimes you get a TSH value, which is say 6 or 7. sometimes we say, no, this is normal for this age. Please repeat after 3 months. After 3 months, when we repeat, the TSH value may be well within the normal range. So we'll monitor the TSH. I'd like to keep the TSH below 4 in growing children. This is my personal opinion. So if I see values of say 5 or 6 combined with some falling T3 or T4 or some other issues, I may consider starting thyroid tablets. So even when the TSH values are borderline, sometimes we would recommend treatment because it overall helps keeping the thyroid levels within the normal range. Like I said, is so important for growth and development. And thyroid hormone replacement, a few things to remember about it. The tablet by itself is very safe. All we are doing is we are replacing something your body is not making enough of. It is exactly like what Dr. Priya was mentioning, an iron deficiency we are replacing, or the carnosine, what she was talking about. So this is again a hormone that is deficient in our body, and we are giving it as a tablet. Once we start the tablet, we check the values, the TSH values, and we know whether we are giving the right dose or not if the TSH is within the normal range. If the TSH is within the normal range, it does not mean that your gland is back to working normally. All it is saying is that we are giving the right dosage of tablet. So once the thyroid levels are so-called within the normal range, please do not stop the thyroid tablet. Tablet has to be continued regularly. It is important that you see your pediatrician or an endocrinologist in person once in 1 or 2 years, because we need to have a feel of your neck. Is there any goiter developing, any thyroid swelling? At least about once in 2 years, it is important that we you have to be examined by the doctor. A very common question that is asked is, can I prevent thyroid problems? And the answer I would say is to some extent yes, and some extent no. So if you avoid excessive weight gain, maintain a good healthy diet, less sugar, less carbohydrates, lots of protein and fiber, and consider a regular multivitamin supplement, maybe you can make sure that your thyroid gland works normally. But because the hereditary and genetic factors are so important in making sure the thyroid works normally, sometimes you cannot really prevent it. And if it happens, we have to just give the tablet. It's an easily treatable condition. Final word about other endocrine issues, which I don't normally talk about, but which I thought I will. Children with Down syndrome, the growth centiles tend to be a bit lower than the normal. So we have special charts for growth for children with the trisomy 21. So the height will be a little bit different, but puberty and fertility will be completely normal. So if the periods get delayed by the child does not enter puberty till the age of 14 years usually, or doesn't start showing other changes of puberty, it is something that we have to approach like otherwise. So puberty and fertility does not get affected in this situation. Dr. Priya touched upon diabetes, other what we call metabolic issues. So chances of developing diabetes or cholesterol or blood pressure. In general, it's a good idea to start screening for these problems from the age of 18 years and check for it at least yearly once. Because of the tendency to being overweight and being less active, these problems start developing a little bit earlier. So it is important that we are aware of it and start checking from it from a relatively young age. For the bones, Dr. Priya spoke about the vitamin D. Another very important factor for the bones is regular exercise. Walking regularly, some physical activity is important both for the diabetes aspect and for the bones to maintain the strength of the bones. These are all long-term issues. As children with Down syndrome are living longer and longer, we need to make sure that after the age of 50 years, the problems that we commonly see, diabetes, cholesterol, blood pressure, thinning of the bones, osteoporosis, these should not become issues later on in life. And the roots for all of that start very early. So from a young age, we have to ensure that children follow and maintain a very healthy lifestyle. I think that was my last slide. I shall stop for this. Yeah. So it's essential that all children are thinking always is that all children. Yeah. Sorry, I just wanted to say, make sure that regular screening tests are there. Sorry.
Yeah, please.
Thank you. No, I'm finished. Yeah.
Thank you so much, Dr. Jayashree, for bringing about these important endocrine issues and telling us that how important it is to address as soon as we can, as early as we can in the for the normal growth and development of the child. And we have received some of the questions for you. And the first question I would like to take, which we had received, it is asked by Mr. Dua, and he says that my daughter Astha, age 33 years, is on thyroid medication. since around 20 years. For about last 3 years, her TSH value fluctuates quite drastically. If we give her Thyronim 100 mg, it comes down to 0.5, and on giving 75 mg, it rises to 7.5. And their doctor has advised them to give this alternatively 100 mg and 75 mg for to addressing the issue. So he wants to know from you, is it the correct way the advice can be followed?
Yes, it is correct. Or 88 mcg is available. So 100 one day and 75 next day averages out to about 88. There is an 88 mcg dosage available. You can give that also and try. Sometimes we have to do a little bit of fine tuning of the dosage to keep the thyroid within the normal range. Can you hear me? I'm sorry, Samiksha went off.
Yes, ma'am. Yes, ma'am.
Okay.
We can hear you.
Okay. So
Yeah,
yes, I mean, it does sound like this is what we would typically do. We would adjust the dose to try and maintain the TSH within the normal range. And the normal range would be, for most people, the normal range of TSH would be between 1 to 4. So if it starts dropping below 1, it means the dosage is too much and we'll try to cut back, like how your doctor has done. And if it goes above 4 or 4.5, it means the dosage is not enough and we would try to increase the dose. So 1 to 4 is a good number to remember for most people.
Thank you, ma'am. And the next question we will take from the chat box. It says, my son is 3.5 years old. We are giving him Thyronim 12.5 mcg. When I need to stop it? I think in presentation, ma'am has already given the answer to it.
The thyroid hormone has to continue all through life because we are not doing anything to make the gland come back to working normally. If we truly detect a thyroid problem, the replacement has to continue regularly.
Yeah. So then the question comes that my son is